Someone, somewhere, is living without sleep for days and still driving a car. Another person can smell a disease before doctors can detect it. And one rare condition can make you believe your own family has been replaced by perfect imposters. These are not movie plots. They are real medical mysteries documented by hospitals, scientists, and brain scans. In the next few minutes you will see 10 mind-bending conditions that can hijack reality itself. And the number one condition is so disturbing that people have begged surgeons to amputate healthy limbs just to feel normal again. 10. Alice in Wonderland syndrome. A child looks at their hands and they suddenly seem huge. The bedroom shrinks. The hallway stretches like a tunnel. The person knows it is not real, but the distortion feels completely physical. Minutes later, everything snaps back to normal. It often appears during migraines, fevers, or intense stress. And it can make a familiar room feel like a nightmare maze. It can make objects look larger or smaller than they are. Episodes can last from minutes to hours. It is often linked to migraine aura. It has been reported after viral infections. It is named after the classic story because the effect is so similar. 9. Prosopagnosia. Face blindness. A woman walks past her own mother in a store and does not recognize her. A man watches a movie and cannot tell the actors apart. They rely on voices, hairstyles, or clothing like a detective. Faces become blank puzzles. Some people are born with it. Others develop it after a brain injury. And it can quietly destroy social confidence. It is caused by problems in brain areas that process faces. People may recognize emotions but not identity. It can be mild or severe. Some cases appear after stroke or head trauma. It affects daily life more than most people realize. 8. Kagura syndrome. A husband looks at his wife and insists she is not real. He says she is an identical double wearing her face. The voice sounds right. The memories are right. But the feeling of familiarity is gone. That missing feeling convinces the brain that something sinister has happened. And the fear can turn into paranoia fast. It is a type of delusional misidentification. It can follow dementia, brain injury, or psychosis. Patients may accuse multiple relatives of being replaced. It can also involve pets or homes. Treatment often includes antipsychotic medication and therapy. 7. Sleep paralysis. You wake up and your eyes are open, but your body will not move. The room feels heavy and wrong. Many people report a presence near the bed. Some hear footsteps, whispering, or see a shadow figure. Your brain is half dreaming and half awake. The terror is real, even when you know what is happening. It occurs when REM sleep overlaps with waking. Episodes often last under 2 minutes. It is more common with stress and poor sleep. Many cultures have legends describing it. It can be reduced with regular sleep schedules. 6. Synesthesia. A piano note hits the air and a flash of blue appears in the mind. A number has a personality. A weekday tastes like lemon. For some people, senses are wired together. Sound becomes color. Words become shapes. It is not a hallucination. It is a consistent, repeatable perception that stays the same for years. It affects an estimated 2 to 4% of people. Many discover it in childhood. It tends to run in families. Brain imaging shows unusual cross-activation between sensory areas. Some artists use it to create music and paintings. 5. Alien hand syndrome. A person watches their own hand unbutton a shirt they just buttoned. The hand moves with purpose, but without permission. Some people have to physically hold the hand down. Others talk to it like it is a separate creature. It can happen after brain surgery or damage that disconnects control centers. And it feels like losing ownership of your own body. It is linked to damage in the brain's motor control networks. It can occur after stroke or tumor removal. The hand may grab objects involuntarily. Patients often describe the hand as having a mind of its own. Therapy focuses on retraining attention and control. 4. Hyperthymesia. Highly superior autobiographical memory. Ask someone with hyperthymesia what they ate on a Tuesday 10 years ago. They can tell you, and they can tell you the weather too. Memories play like a non-stop documentary. Good moments never fade, but neither do painful ones. Many describe it as exhausting. Because forgetting, for them, is not an option. It is extremely rare, with only a small number of confirmed cases memories are detailed and time-stamped. It is different from photographic memories. Some people show obsessive organization habits. It can increase anxiety because negative memories stay vivid. 3. Congenital insensitivity to pain. A child falls and keeps playing with a broken bone. A person touches a hot pan and feels nothing. Pain is an alarm system. Without it, the body can be destroyed by accidents that would normally cause instant retreat. Many people with this condition must constantly check their skin for cuts, burns, and swelling. Because the damage is silent. It is caused by rare genetic mutations affecting nerve signaling. It does not mean immunity to injury. Many patients suffer repeated fractures and infections. Parents must watch children closely to prevent self-harm. It can shorten life expectancy without careful management. 2. Fatal familial insomnia. It starts with mild insomnia. Then sleep becomes impossible. Days pass with no real rest. The body weakens. The mind begins to slip into confusion and panic. This is a rare inherited disease that destroys the brain's sleep control. And once it begins, there is no proven cure. It is linked to a prion mutation in certain families. It usually appears in adulthood. Symptoms include sweating, rapid heart rate, and hallucinations. Progression can take months to a few years. It is considered universally fatal. 1. Body integrity identity disorder. A person looks at a healthy leg and feels intense distress, like it does not belong to their body. They may feel complete only if it is removed. Some try to injure themselves to force an amputation. Others bind the limb for years, living with constant discomfort. Brain imaging suggests the body map in the brain may not match the physical body. The result is a craving to change the body to match the mind. It is also called xenomelia. In some research it is rare but documented in medical literature. People often hide it for fear of judgment. Some report relief after amputation. Ethical debates continue about the best treatment. You just heard about 10 conditions that can bend perception, erase faces, steal sleep, and even turn your own body into an enemy. Gras syndrome can replace loved ones with imposters in your mind. Fatal familial insomnia can erase rest itself. But body integrity identity disorder may be the most unsettling, because it can make a healthy body feel wrong every single day. If this kind of real-life mystery fascinates you, like the video and subscribe for more. Which condition surprised you the most? Which one sounds the scariest to live with? Have you ever experienced sleep paralysis? Do you think synesthesia would be a gift or a curse? And what topic should we cover next? Strange brain disorders, rare human abilities, or the most mysterious medical cases ever solved?